Welcome back to another episode with ByrdAdatto. And today we're going to talk about as states keep reopening, there's a lot of questions that have been coming back. I've seen in articles and newspapers and obviously from clients of ours as testing. And the words used often as, should I be testing my employees or should I be testing, and what kind of testing? And so we felt like we needed to go find an expert that could help us out and speak lawyer talk at the same time speaking to as a medical professional. And so we're lucky to have this person right here. And Michael, would you please introduce our special guest?
Back for another appearance, our partner, Jeff Siegel, who we've introduced many times as both a lawyer and a doctor. But I think, Jeff, you should always be introduced by the fact that as a young neurosurgeon, you appeared on an episode of Rescue 911 with William Shatner.
I did, and that is typically what I'm known for. So thank you for bringing that up yet again.
Well, Jeff, we're excited that you're here because, as lawyers, we can read what statutory things say, and a lot of things are out there as to what you should be doing. And we're not talking about the testing of, don't come in if you have symptoms, or doing a test of coming in and taking someone's temperature. These kind of questions that we're seeing are much more in depth, are truly going into the swabs or blood tests. And on a medical side, let's start there first, is what are you seeing, or what are your thoughts as far as just testing your employees at those higher levels, and at what points do you think they need to be tested?
So I'm not sure that I would be considered an expert on this, but I can tell you I do have an opinion. So if that opinion makes me an expert, I'm ready to jump right in.
I'll be very clear. You're an expert compared to Michael and I on this field.
Fair enough. I'm ready to roll. So the question is, does testing need to happen? And let's start with a general medical practice. So if the state mandates that you have to do certain tests, either by blood, saliva, swab, etc., you do what the law mandates. Now, most states are not mandating that. There are some states that suggest that before a patient undergoes a procedure, they need to have a nasal swab, and their PCR test is negative, and they quarantine themselves for X number of days before the procedure. But that's the exception and not the rule. So forget about that for the moment. If we're just talking about the general medical practice, my working rule of thumb is that once you've called them in advance, you've done the checklist, you don't have fever, you don't have shortness of breath, you don't have X, Y, and Z, you've not been to a hot zone, et cetera, then they're ready to come in. Just in my book, assume everyone is pre-symptomatic and engage in social distancing, wear a mask, wash your hands. I think if you do all of that, you will have discharged your duty to what is reasonably safe. And the reason I say that is because if we relied upon testing, and there are all types of tests, some are blood, some are saliva, some are sticking the swab down your nose, which most people can't do well or can't do accurately. I think you'll end up with both false positives. I think you'll end up false positives and false negatives. In addition, it costs some amount of money. It's not cheap. And finally, it takes time to get the results back. So I don't know how any of that would get you to a better answer than the working assumption that everyone should be assumed to be pre-symptomatic, and you engage in the appropriate precautions with social distancing to the extent that you can. And if you're getting close, wear a mask, wash your hands.
Yeah, and I think you've said this multiple times, is it really does start with good hand hygiene in this particular disease, compared to virus, compared to a lot of other things, is that good hand hygiene and that mask are the two things that can help. And I know you have a great story of just not just a client, but your brother as an incident, what happened with his practice.
Yeah, so he hasn't been open that long. He's in Texas, so it was one of the first practices to reopen. And he had, and I'll give two examples. One is a patient who showed up. They ended up doing all the right things. Patient waited in her car, came in, no one else was in the office. They did the exam, but wore a mask. Patient wore a mask, washed their hands, so on and so forth. And then there was a phone call 9 days later from the hospital saying that this patient was now in the emergency room with a diagnosis of COVID-19. So he started freaking out. But the guiding principle had been he had assumed that she was pre-symptomatic, and it may be that she wasn't even pre-symptomatic at the time, but the working assumption makes it easy to get to the proper answer, which was that they had done everything properly, and according to the CDC, there was little more for them to do other than to be vigilant that they didn't get symptomatic, which they would be doing anyway, but they didn't have to shut the practice down, they didn't need to call other patients, they didn't need to do anything. Now let me compare and contrast that with an employee who said, oh, by the way, over the weekend I was with a friend, and so fair amount of close contact, and I just learned that this person was diagnosed or has symptoms that match COVID-19. Can I come back to work? The answer at that point is no, even though a number of days had gone by, but we're getting back to that checklist. You know, if someone has fever, chills, or exposure to someone, they don't come back in unless a period of time has elapsed and they're not symptomatic, or B, there's a test. So in that particular case, you can do one or the other. Don't come back to work for X number of days. Or B, if you want to accelerate the process, we can get a swab and see what we see. So those are the bookends of how I think about this. Look, there's a lot of ink that's been spilled on, you know, a gazillion algorithms on how to manage this. I looked at several of them, and the use of, you know, those 45 pages of algorithms is to serve as a substitute for general anesthesia, because it will do nothing other than put you to sleep. Nobody can follow those algorithms. They can't remember them. Even worse, if you have them in your office and you say, we're going to rely upon them, and somehow you forget that, you've turned an asset into a liability. So I like to keep it as simple as possible, recognizing we can't eliminate risk. We don't eliminate risk in anything. This is no exception. We just try to do what is reasonable, what is best to keep ourselves safe, our employees safe, and our patients safe.
And last, and I want to ask this question, Jeff, in your mind, let's throw out the whole medical community, because obviously they are seeing patients, and most of our clientele are trying to treat healthy patients. So those are the testing and clarity that you have makes sense. What about your typical business? If you're a grocery store or, you know, a law firm or a other place, are you having any clients, or have you heard of them testing their employees again above and beyond what we just talked about, the criteria of making sure they don't have the symptoms, or maybe doing, you know, checking for fever?
I think it's window dressing. Yes, I've heard people doing it. I think logistically it's very difficult to do, primarily because false positives and false negatives. False negative will create a false sense of security. False positive will create unnecessary worry. And you don't want either of those. I mean, you certainly don't want a false negative, the false sense of security. That's the worst of every world. But you really want to create unnecessary worry. I think if you just adhere to the general guidelines, you're going to be better off. There's no reason you can't query everyone every day. You know, have you had a fever, chills, shortness of breath, muscle aches, been exposed to anyone? You're going to get most of the relevant answers short term, and then you shuttle the proper people for testing. Now, as a lawyer, I always say it depends. There are exceptions to the rule. There are situations where people are packed in close together, like a meatpacking plant or an auto assembly line, where you really can't separate them from each other. A prison, for example, there it may make sense to do testing. There's a better rationale to do it. But for the typical business, and that includes the grocery store, I don't see the upside to testing, only because I'm not sure the information that you would get would be accurate and or actionable better than just adopting the proper workflow and the proper precautions, assuming that everyone you're going to run into is pre-symptomatic.
That's awesome. Michael, I don't know if you have any takeaways.
Just what I hear is, following the guidelines is, kind of akin to the standard of care as we know it right now. And so it kind of checks your boxes on the medical side and the legal side. I suspect that as we learn more about COVID-19, the guidelines and the standard of care could adjust, and we will need to adjust, whatever our protocols are. But it really, Jeff, was helpful to take what seems like mountains of information and declutter it into some simple, actionable steps for people to take.
Yeah, I mean, it's reasonable. I know there's some media attention to whether we should be wearing masks or not. And the answer is probably seems to make sense. Certainly, if we look at Asia, what have they been doing, and what do their numbers look like? And if you look at Singapore, Hong Kong, even Japan, one thing that everybody seems to be doing is that they're wearing various types of masks, and they're not even N95 masks. They're mostly surgical masks. So I personally would rather be doing something that may not work than not do something that does work. And we all wear masks in the operating room, and we don't think twice about it. So my thinking is these are things that will keep you on safe ground. Nobody will beat you up for wearing a mask, washing your hands, engaging in social distancing. I think it's a good move. If it's overkill, and we learn that after the fact, it's been little more than a temporary inconvenience. But the flip side is also true, that if we don't do it, and it turns out to have been really important, then I think we missed the boat on that. You never want to miss the boat.
No, you don't. Well, Jeff, always appreciate your insight. I know for the audience, Jeff, we get to hear his insight a lot more. But I love the fact that you're willing to come on and speak to everyone and inform them again with your opinion as the expert compared to Michael and I.
And by the way, the version of me on Rescue 911, I had more hair on my head, no facial hair, and I was considerably younger. You can find it on YouTube.
Your quote was, I look like a 12-year-old is what you told me.
That would be accurate.
Well, good. Well, thanks again for joining us, Jeff. Michael, always good to see you. And until the next time, we look forward to our next episode.
Thanks, everyone. Bye-bye.